Let's be honest, getting a diabetes diagnosis for yourself or for someone you love can feel pretty overwhelming. But here's the most important thing to know right from the get-go. Knowledge is absolutely power. In this explainer, we're going to give you the tools you need to understand this condition and, more importantly, to take back control of your health.
You'll often hear diabetes called a hidden enemy. Why? Well, because high blood sugar doesn't always hurt right away. But over time, if it's not managed, it can quietly cause some really serious health problems. Now, this isn't to scare you. It's about giving you the first, most crucial step toward living a long, healthy life. Understanding is everything.
Okay, so here's our game plan. We're going to break this all down into 5 key areas. First, we'll get to know this hidden enemy and its risks. Then, we'll talk about symptoms and how doctors diagnose it. After that, we dive into the day-to-day stuff, the rules of diet, the role of exercise, and finally, something really important, how to handle a low-sugar emergency.
So first up, let's pull back the curtain on the risks. It's so important to understand what we're actually up against, because once you know the why, the how to manage diabetes becomes a whole lot clearer.
This is a serious list, I know. We're talking about heart disease, kidney failure, even blindness. But listen, here is the most critical piece of information on this slide. These things are not caused by diabetes itself or by the medication. They are the result of uncontrolled high blood sugar over a long time. That is such a crucial distinction. You control the sugar, you dramatically reduce these risks.
Okay, let's just tackle a really dangerous myth head-on, right now. A lot of people worry that diabetes medicine is what harms their kidneys. The truth? It is the complete opposite. It's the uncontrolled diabetes, the high sugar itself, that damages your kidneys. The medicine is your ally, a tool that's there to protect your organs, plain and simple.
All right, let's shift gears. How does this whole thing even start? How would you even know if you have diabetes? Let's look at the warning signs your body might be sending you, and then the tests that give a final, definitive answer. So how does your body tell you something's up? Even though we call it a hidden enemy, there are often some pretty clear signals, as long as you know what you're looking for.
And here they are. Things like losing weight without trying, or feeling starving all the time even though you just ate, being incredibly thirsty, noticing that little cuts or scrapes just take forever to heal. Even issues like impotence can all be signs that your blood sugar levels are out of whack.
So seeing the symptoms is one thing, but to get an official diagnosis, you need some very specific tests. Let's break down the numbers that doctors are looking for. The first big one is a fasting blood sugar test. That just means it's done after you haven't eaten for at least 8 hours, usually overnight. If that number comes back as 110 milligrams per deciliter or higher, that's a major red flag for diabetes. This second test looks at how your body handles sugar right after a meal. So, about 2 hours after you eat, they check your blood sugar again. If it's at or above 180, that's another key sign. It basically means your body isn't doing a good job of moving sugar from your blood into your cells for energy. And then there's the HbA1c test. Honestly, this one is a real game changer. Think of it this way. The other tests are like a snapshot, a picture of one moment in time. The HbA1c is more like a movie of the past 3 months. It gives your doctor the big picture, your average blood sugar over a long period. A result of 6.4% or higher pretty much confirms the diagnosis.
Okay, now we're getting into what is arguably the most important part of your day-to-day management, your diet. Remember, medicine can only do so much. The food choices you make every single day are the real key to getting this under control. So, when we talk about diet, the first thing to understand is carbs. And here's the deal. Not all carbs are created equal. Simple carbs, think sugar, white flour, juice, they have very little fiber. They hit your bloodstream like a tidal wave and cause a huge sugar spike. But complex carbs, the kind you find in vegetables and whole grains, they're packed with fiber. They break down slowly, giving you a much gentler, more manageable rise in blood sugar.
And here are the main culprits. We're talking sweets, cookies, white bread, fried foods, sugary drinks. Yeah, these are the things you really need to limit or even avoid because they just make managing your blood sugar a nightmare.
On the flip side, this is what you want to be loading up your plate with. All those colorful vegetables, whole grains, these are your new best friends. They're full of that good fiber that slows everything down and helps you stay in that safe, controlled zone. Now let's talk about a secret weapon, protein. When you eat protein with your carbs, it slows down that sugar absorption even more. So for example, eating a bowl of plain rice will spike your sugar way faster than if you ate that same rice with some dal or lentils. Just look at this table. 100 grams of peanuts or almonds has 26 grams of protein. That's a powerhouse.
Just a quick word on fats. Now, they don't directly raise your blood sugar, but the wrong kinds of fats can increase your risk for heart disease, which is already a big concern with diabetes. So the idea is to limit things like butter and fried foods, and really try to avoid saturated fats like palm oil or dalda, which is a type of vegetable shortening.
All right, let's move on to the second pillar of diabetes management, exercise. Diet and exercise are a team. They go hand in hand. The best way to think about exercise is that it helps your body use up sugar much more efficiently.
And here's a super simple, totally doable plan. The goal isn't to become a marathon runner overnight. No. The key is consistency. That's what teaches your body to use sugar for fuel instead of letting it hang around in your blood. Find something you actually enjoy. Walking is fantastic, and just aim for 45 to 60 minutes most days of the week. A great goal to shoot for is walking 5 kilometers in an hour. But of course, always check with your doctor before you start a new routine.
We've talked a lot about high blood sugar, but sometimes it can actually drop too low. That's a condition called hypoglycemia, and it can be really dangerous. Knowing exactly what to do is absolutely essential.
Here are the emergency steps. First, you have to recognize the signs. Sudden sweating, feeling dizzy, a pounding heart, or just feeling confused and uneasy. If you feel this happening, you have to act immediately. Don't wait. Eat something with sugar right away. A few pieces of candy, a sweet biscuit, anything to get your levels back up fast. And this last part is critical. If you find someone unconscious, never try to put food or drink in their mouth. Get them to a hospital right away.
So as we wrap this up, let's just come back to the main message. This isn't about some magic pill. The real power, the true control to manage diabetes and live a full, healthy life, it lies in those small, consistent choices you make every single day with what you eat and how you move.
So now you have the knowledge. The power really is in your hands. So the last question isn't for me, it's for you. What is the first small, totally manageable change you're going to make today to start taking control of your health?